Hello, I'm Sana Khan and you're watching Medicircle. Today we have with us Jagan Mohan Reddy. He is a senior quality assurance software engineer at GE Healthcare. He is an experience of 20 years in JCI and NABH hospitals. Please welcome him to our show Rendezvous on Patient Safety series. Hi Jagan, how are you?
Thanks, Sana. Thank you. Thanks for nice briefing.
Okay, Jagan, to begin with, patient safety is a global health priority, hence proved by COVID. What are your thoughts on the same?
Yes, Sana. I feel this is same, here because since this pandemic situation throughout entire global is a challenging, same issue. How to, provide the quality of service to the patient, COVID patients, those who comes to, hospital. Since it is pandemic situation, we can see the many footfalls in the hospitals. But same time, how to handle the COVID patients in the unexpected maybe footfalls comes to the hospital.
Mhm.
Yes, since we have these all hospitals now facing this issue, the patient safety is a very important aspect when you talk about, especially in the COVID situation.
Right.
We need to have some plans when patients comes to the emergency, or it may be walk into the hospital.
Mhm.
We have the policy called the triaging policy. So we triage the patients, even the COVID is the three categories: the mild, moderate, and severe. So once you triage and segregate the patients, it is easy to handle patients who need the first priority treatment.
Right.
Example, if patient comes to triaging, like right, then immediately we transport the patient to the critical care area where we can have all life supporting devices. So that is immediate need the care. So, but if the mild patients is not required that immediate, that life, supporting devices, we can transfer, we can shift them to the normal general wards, or in maybe where we can have this, uh, general wards, or cubicles like in hospital sector. So once you do assessment, the assessment and triaging is play a major role in the patient safety, in the COVID situations. Once you transfer, yes, next is how we can now be segregated patients, and we distributed among the priority as priority need, immediate care, or it may be step down. But now what is the next challenging job is, see, the how, who is going to provide patient safety to the patient.
Mhm.
So in any hospitality, the use force in you can say medical fraternity is nursing. If nursing team, like you can say the force is having very strong in the hospital, obviously the 100%, at least 100% I can just is that patient may receive the good quality of care, which is called talks about patient safety. But yes, now what happens, even the critical situation, even the nurses also we have the priority. They experience more, experienced nurses, those who have course specific, competency, like, critical care champions we call. So we distribute them to them, take care of the patients to that dedicated departments where COVID, situations. So this is a plan. Once you have plan, then we implement that plan. So sometimes what happens that COVID patients, see, psychologically, patients attenders, they may be in the depression. So you see some patients, they go and upstairs, terrace, and they will jump from the, there are some incidents. So in this way, safety comes again our infrastructure of the hospital. How you restrict patients to, how you monitor, patient movement, each movement where the patient is moving. I'm talking about normal COVID patients, those who come to asymptomatic patients, they maybe keep moving in the. So this is psychological support, and in the caliber nurses to handle the cases,
Right.
and life supporting devices, how you handle it, because 100 patients you cannot able to provide life supporting devices. Since we are in India, we are facing a lot of issues with the devices like oxygen cylinders, cardiac monitors, ventilators.
Right.
So what happens, the priority is very important.
Mhm.
Okay, depending on your assessment, triaging, then manpower distribution, supporting services, or use for technology, like supporting services, lab, radiology. It is all is a teamwork. I see that prioritizing is a very, very, very important aspect when it comes to patient safety. Yes, we do that. So that it will gives more satisfaction. The normal patients, a mild moderate patient, you can shift to the ward, and same protocols you follow. It is not much bigger impact on the medication, but it is same similar medication we give for either it may be, fewer patients, or it is, because since we don't have that, exactly the evidence-based practice, for the medication for the corona patients.
Right. The theme for this year's Patient Safety Day is safe health workers, safe patients. What is your contribution towards the safety of the health workers?
Yes, Sana, it is very important. The organization where, starts like in a small scale organizations, or it may be in a use, we have 500,000 build a hospital. High priority is patient safety as well as equivalent to employee safety.
Mhm.
So any accreditation we take, like in the world, like NABH or JCI or JACO guidelines or Hipaa guidelines, anywhere in the globe, Europe or Middle East, anywhere you take any accreditation talks about first is patient safety. Then equal importance they given to employee safety, because without employee you cannot provide safety to the patient. First, employee should be safe, where you work. So it comes to, for example, it talks about patient safety. So now these days in the technology plays a very important role, like digitalization in patient safety. Since my experience as end user, as a nurse, or it may be nursing leader or clinical quality manager, now I'm being as a software engineer, I'm supporting to my software. It plays a very huge role, but that impact he cannot understand the patient, because indirectly or directly, the software is helping a use to users. It is very friendly user softwares are available in the market. That is it. Another thing I talks about the infrastructure and layout of your hospital. As for once you build a construct your hospital, then for example, I say that fire safety protocol. You should have the fire safety protocol as per guidelines. It is not for your convenience. When you have, there is a patient, why I'm saying about, for example, of this fire safety, it is linked to your patient safety. Because tomorrow if fire happens, how to evacuate the patients from your building? I'm talking about high-rise buildings. So this is like, for example, one. Then same thing, when you follow standard protocols of the infection control protocols, what guidelines says, then you should religiously should follow and implement your organization. That is one type of patient safety you provide. Same thing you talk about patient correct, like say the safe medication practices. When the nurses, you have skillful nurses, it is your responsibility management to be take the skillful nurses and train them and motivate them and make them to understand what is safe patient medication practices in our hospital, or what entire globe they will follow it. So this all 1, 2, 3, 4 I can talk, like it's a huge chapter, be frank to say. So when we have this patient safety, if I say a small patient is lying down in the bed, you can see the bed, you can say patient is safe or not. How? See, when patient is lying down in the bed, both sides should be, side rails should be up, because patient should not fall from the bed. Either patient may be conscious or not conscious. So when you see our babies, what we do in the cradle, right? Cradle is having surrounding is a all boundary, because he cannot come out from it. Same equivalent to like baby or patient. The patient when on the bed, anybody they didn't put a side rails up to the patient bed, then he may be fall. And you see many number of incidents falls, it is happening in a hospital, and it is becoming incident and sentinel event. So this is some simple things of patient safety. Patient signages. Your signages talks about patient safety in the hospital. If I am a patient, normal patient, my looking up your hospital signages, I know what it is. It is hazardous, it is dangerous, it should not be open this door, right? Yes or no, there's something, you should not. So that signages will speaks about your patient safety, right? And infrastructure, the anti-slippery tiles. You go to toilets, many patients you can see in the patients goes to toilets and they slip and they will fall.
Right.
There's so many deaths are occurred in the bathrooms. Why? Because is it slippery tiles. Normally, as per norms, it should be anti-slippery tiles. Then you should have sidebar for the patients, those geriatric patients. When you sit on the toilet, you cannot able to stand your own. You need some support. You need some assistance. That's right. What we so nurses what we used to follow, and still we are recommending and to follow every hospital. Always you categorize patients who is having high risk to for example, you go for 80 years patient coming to your department. He's a geriatric patient. The age related changes happens in our body default. Okay, vision defect, hearing loss, something like the joints should be resistant. He cannot freely walk. he needs some assistance. So this type of patient, so this is called, we have in the nursing assessment, different assessments. It is called age specific assessment. Okay, a neonatal baby comes, what assessment you do? Okay, a pediatric baby, 10 years baby comes, what assessment you do? A pregnant mother comes, what assessment you do? Okay, a geriatric patient comes, what assessment you do? So it is patient safety depending on your assessment.
Right.
You assess the patient, then plan your, what is the action plan, then implement a plan, then evaluation, you see that there is a best result you can see as for patient needs. So in this, you see that the patient is high risk to fall. Why I'm saying categorizing patients in the like for example fall, or it may be something else, because defects, it is age related. I said age related. Say neonatal baby comes to you, he cannot talk, right? Only parent will can talk to you, right? So this is all when you keep in mind, as we used to train the nurses every time. It is not one time and train and leave them. It is continuous, only education about patient safety. Okay, then when it comes to employee safety, yes, as employee, when you join the day of the organization, you know the hospital which standards it is follows. Either it is follows NA-based guidelines. It is NA-based certified hospital. I know that means they are following the standard. That's why they got NA-based seal on their hospital. Same way, international standards, when you talk about JCA, Joint Commission International. So I worked in my lifetime in entire hospital like JCA certified hospital. Very few in India, if you talk, like 30 hospitals maybe in the like Apollo, like Medanta, like Artemis, like some. This is so what they do the international standards, not even the national standards. They follow international standards guidelines. Why it is differentiation? Even these NA pages come from the child of the JCA. Okay, we can say. So now employee safety is always when you select the hospital, you join the hospital, the day itself they do the pre-employment checkup. Why? You need something like document your pre-employment. Then later, which is safe environment? Are you working in safe environment really? Think yourself. Okay, they're following. See, now just name sake they will not. You cannot follow the guidelines. Then when if I am a nurse, I'm working in intensive care unit. If anything happen, fire. First, I think that how can I escape myself fire? Right from the happen. Yes, as an employee, first is your safety is important. Then later patient safety. Because when you are safe as an employee, then you can able to help evacuate the patient. Don't be like we are not Supermans and we are not Batman, something like that. We see always employee safety. Always I think as a self, yes, I am an employee. I am working in a safe zone or not. Yes, then it's fine. Then next comes to what type of cases I'm handling. It is infectious diseases, for example, COVID. Yes, I am taking care of COVID patient. Are you having the PPEs which is protecting me from the infection? Like, say PPEs, personal protective equipments we call, like goggles, masks and gowns and disinfectants. Our management is providing sufficient to you to treat your patient? Yes, then I am in safe zone. It's a no, then I am in the risk, because I may get, see how many healthcare workers they got the COVID positive, even though they have. So what I meant to say, employee safety is not only responsibility of the hospital, as well as is equivalent to the employee also responsible to understand what employee safety protocols guidance says, right? So when I'm working in a OT since 6 years, so after standing, you see that one surgery goes to 8 hours, 10 hours, 12 hours, 18 hours, right? Every day I have to stand 10 hours in OT, okay? So you see that after 6 years, I get my legs are paining and varicose veins, it is diagnosed. It is called occupational health hazards, right? So when a nurse is working in the radiology department, exposing to radiation every day, either X-ray or maybe CT scan or anything, right? So I am protected something, I am in a safe zone. You should think yourself, you ask yourself, then yes, I am safe, then fine. Then you have the radiation, this lead batch with you. So I can able, they will do what they do, they will check every day. Yes, Jagan is working in the radiology department. How far he exposed to radiation? That batch itself, my batch itself, it will give a what the radiation rate. If really we see the way many nurses in cath lab where the radiation exposure. So like sometimes a fertility problem, they may have pregnancy. So what we do? We take as employee safety, what immediately will take them up From that department, I will put in a lighter department. I have to think about my safety, my employee safety as well, right? So when it comes, if you have the radiation is high, your batch says it is high, then you send them on the radiation leave, special leaves on radiation. So 1 month radiation with pay. So this is all become considered as a employee safety. So when we talk, so many things like that. It's a use chapter. It's a patient safety, and it's a NABH. It says that care of patient is one chapter. Care of patient is a patient-centric chapter. When it comes to JCI, first chapter itself, it is called IPSC, International Patient Safety Goals. It will describe about use checklist. This is all. It will comes as employee safety, patient safety, equal importance in the organization. Employee is safe, then he can able to provide patient safety. If employee is highly satisfied, he can able to deliver good quality of care to the patient.
Patients, right?
Yes. If I am very happy, then I can able to do my job satisfaction with GE 100%, right? Employee satisfaction is very, very, very impacting on to day-to-day life, patient, even the quality of care what they deliver.
Okay, Jagan, this is the digital age and healthcare is highly influenced by technology trends. How do you think this transformation will support patient safety today?
Yes, Sana. Since 20 years, I seen the first 5 years as a nurse at bedside. I seen that there is no technology, but technology they use only where management use only where there is a revenue impact happens. There they will take because they don't want to lose a single rupee. Okay, that is the first priority some organization. But I'm talking about really patient safety. Then it is depending on the luck. Olden days, what? Okay, because your nurse is your nurse is a very good, your doctor is very good, and you are lucky. It is in all God's hand. Okay. So now when it comes to now digitalization takes place, it is a tremendous improvement in the healthcare industry. So since 15 years, I'm working with different softwares of hospital software. Then I was coordinator for my hospital side to the those who provide the vendors in the software engineer. So I can see a tremendous improvement. I can say there is digitalization is going like artificial intelligence is taking place huge role. For example, I'm working where my GE hospital, GE healthcare. What is software we have, Sana? Because it is open the eyes of the management and see the always lucky a patient should lucky to have that type of software. I can say many incidents you can prevent by using software. Because end user is always stressful and busy at bedside. Your software provides a tremendous triggering alarms and notifications, even notifications as well as severity wise. Same I said, mild, moderate, severe. If I am a nurse, I'm taking care of the 4 patients. I cannot be I'm not a god to what it is happening patient bedside. Okay, in another bedside, but 3 patients. So what happens? This triggering alarms, triggering notifications, user always get that. Yes, I have to do this medication. I have to give. I forgot for 1 hour before I will give now. Because your system will, your software will trigger you, stimulate you to do that work. If any heart rate goes very high, okay, my heart rate is normally, I say for 60 to 80, but 100 is going on my patient heart rate, but I am not at bedside, but still it will be, it will give trigger, user, see your patient is going, something is going wrong, go and check it. This is what. So even the not only at patient bedside, now you can see the remote areas. In GE, we seen just recently we had discussion. Somebody else 200 kilometers away, you can do an ultrasound for a pregnant lady. I can able to view that, the sound, baby sounds, I can able to view sitting, 300 kilometers away. What the technology, right? So what I meant to say, digitalization, when it comes to patient safety, highly impact. Okay, it is highly impacted. This is, for patient safety to improvement with the digitalization. Second thing is PACS, anything radiology. So you take on X-ray. Today is the concept of green buildings of all hospitals. They're going no film wastage, no film produced by physical, only for software. They will send you to your mail Android. You can see your images what you need. So it is green building concept when it comes to you. Then it comes to very important. Let's see Hipaa Guidelines in 1996. US federal government they issued that. How far it is patient safe data is safe when it is comes to patient safety. So now this digitalization versus this, it may be server-based software or it may be cloud-based software. Your data is secured. Okay, you are not lost. See, something server is gone. You lost your entire data of 10 years patient data. So this is a one thing consideration. Same thing, auto updates or auto calculations. Now I am a nurse. Olden days I used to say when bypass heart surgery done next, I used to receive that patient from OT. Then I have used big chart, which is almost 1 meter chart, and I have to calculate 0.5 ml, 5 ml, 10 ml, 20 ml. Then when you end of the day, manual entry, so many mistakes. See, a patient when you take intake and output, when instead of positive value, by mistake I calculate because manual entry, human errors, it will become negative balance. Now doctor comes around and he say, why patient is negative balance? That means he's having some problem, give some more medication because of my manual entry. Now digitalization takes, you no need to worry. Automatic it will give the calculation whatever infusions are going. In summary, you can see how much, okay, 2000 ml you given fluids, 1000 ml is output. Very simple. What a beauty of the system. So as an end user, as a nurse or a doctor, they will love that, right? Otherwise, every day it is stress, right? To calculate, take small calculator and take your, keep calculating. Then same way, medication errors. How can we prevent medication errors? Because you manual handwriting always, doctor's handwriting, right? Nobody can understand the world actually except him. When olden days it comes. Now digitalization, you cannot, whatever you write, it caps in the capital letters, right? Then we use the barcoding system, the drugs, or it may be patient wristband. So there is a correct patient when I'm giving, I will scan the barcode. So I know that I'm giving to Sana. Yes, Sana is my patient, for example, I'm saying. Yes, so there is no, I'm not giving a wrong drug to wrong patient. So we can talk like plenty of things like, as I see, I'm a user, I'm not a doctor, but I know what exactly, because more, you see, the use force in the hospital is nursing fraternity. Okay, nobody else. So 90%, 95% I can say who spend with patient is nurses. In the world. So even I can say the maximum your output or your recovery also in the nurse's hands. Is it true? Because 20 years of experience I'm talking with this. Doctor will comes, he will see you 2 minutes, he will leave, and he comes after 24 hours. But 24 hours, who is taking care of you? A nurse. If nurse is having a skill, this is good. You are in safe hands. Nurse is having a good, awareness of the protocols of patient safety. You're good. So this what it comes about, it's a huge topics actually to talk, but I think we don't have so much time. So I hope that. So this is a lot. It is digitalization, no. But since I was, in a global conference, the nursing conclave, I was a speaker about it. I presented 1 hour on HIS, hospital information system, how it will help for nurses. So even the government, think about the government sector. Government sector, or maybe some accreditation says that it is mandatory that something you have to use the software and get some subsidy from somewhere else. The government can do some type of rule. So what happened these days in bad luck in our India, we don't have any good statistics of the medical statistics. We don't know what is called adverse event, what is how many patients have sentinel events, how many incidents happen, what is the mortality. We don't have a good, and I am not criticizing an hour, but we don't have that statistics accurate as you can comparing to Europe. I seen in Europe for 1 month I was everything, even the government medical college, they follow all quality indicator statistics. They have to update online government website. What is the beauty? So I expect that type of things comes, our Indian, our Indian doctors are very worldwide, we are famous in medical. I am saying you, anyway, go in the globe, Indian nurses are available, Indian doctors are available, because we have that much, privilege to serve the throughout globe. But only thing is system has to improve. When digitalization takes place, the patient will get benefit, organization will get benefit. It feels that patients in safe hands as feel with the digitalization.
Wow. Diagnostic errors, healthcare acquired infections, medication errors, readmissions, wrong site surgery, and communications are the major patient safety issues. How do you ensure proper patient safety in this situation?
Yes, Sana, it is a similar question what I thought before.
Right.
So digitalization maximum take care of this incident. Okay. For example, I talks about diagnostic error. So diagnostic error is if you have total digitalization, I cannot say that 100% you will be in safe hand. So, for example, one small incident, you go to a lab, right? But everything is digitalized, but somebody has to draw your sample, right? Yes or no? Somebody has that drawing person is having skills, then there's no bug in the blood or it may be. Okay. Then later you said then system do their own process, artificial intelligence use, they will do, they will. But when, for example, I'm saying diagnostic error. If you have the skill on that subject, see, there is diagnostics where normally we say provisional diagnosis. And for example, patient admits, you suspected some diagnosis because based on the signs and symptom. Okay, now, okay, later reports you decide something. But I don't know, today's many people, healthcare workers, those who are doctors, maybe everybody depending on the technology. Even too much depending on technology also it is sometimes we do this type of errors. See, if phlebotomist is drawing a sample, he know which vein, how to draw, how much sample you have to draw, then it's fine. You have done your job great, then it will come to a good report. If you the sample when you're drawing itself, you will not wear a glove, you didn't wear a mask, you contaminated whatever the sample you collected, then it may be wrong sample labeling you done, then you sent a lab. So machine will not detect that what you done wrong, right? So what happened? These type of errors normally. So what happened? What we used to do in hospital, we have a log, okay? So when it goes to when you collect the sample, there should be double check. One person will collect the sample, and loudly details. They will ask the patient that, hey, Mr. Jagan sample, this is a blood sample, CUE, I am taking. His number is ID. So they will verify, double check. They'll put a label. So what happened? We can minimize, and we have log. So it will go to lab. So if it goes to lab, when the report comes, those who are signing of the report of phlebotomist, sorry, a microbiologist or it may be hepatologist, anybody, they say Jagan age is 30 years, okay, but his CBP, HEP is 4. So nobody person is signed. So there is a critical thinking they will apply. Then they will say, hold this report, recall back. What happened to that patient? What is the symptoms, signs and symptoms of that patient? It is really his, you have any previous records, they will check it. So verify when you are releasing before critical values to the patient. Got it?
It's the process.
Yes. See, because if you release immediately blindly because machine is sent some value, but it will impact on your patient treatment, right? They think really HB is Jagan, HB is 4, but looks is a normal patient. Okay. Your signs and symptoms should be evidence to your report. So this is what we used to do. So what we do is normally, whatever nurses normally they request, they place request to against lab or radiology, we used to write, okay, chest X-ray. There is a request. In bracket we write patient on ventilator. So the user, those who are going to do the chest X-ray, he knows the patient is on ventilator, then I have to go for X-ray. So he knows what to concentrate, where to concentrate on the investigation. So this information gives, so yes, say we cannot say 100% we can prevent errors, okay, but we can reduce the error. You see and any guideline, they never say that 100%, nothing is 100%. Any guideline says try to reduce your incidence in hospital, either medication or it may be wrong site in surgeries, this is all. So when it comes to UTI, hospital acquired infections we talks about, this is a little bit conflict question, I can say, but hospital acquired infection means when patient comes to hospital, when at the time of admission he doesn't have any signs and symptoms of the infection, right? Then after staying 3 days or 4 days, then he developed the new signs and symptoms, then he got something positive. So how he got it? Because it is transmitted by healthcare workers, either nurse, either doctor, or maybe other healthcare worker, because when they touch one patient and go to another patient, right? So these people, they will carry pathogens to infected patient to normal patient. So because that's why we say in our hospital to prevent this, we have every bedside. You see that when you enter patient bedside, foot end, right? You go normally foot end, right? The patient. There is one stand, there is one bottle, it is called sterile bottle, every bedside. So when the user goes to there, you touch patient, see the sterilium bottle, take it 2 drops and wash your, hand, like, rub your hands and go to next patient. So what I done my life, I kept one nurse for meant for only for going for the doctor rounds. Because whenever doctor go for rounds, because doctor will see 10 patients in that department. He will go with all the patient, either positive patient, negative patient, he has to go. So I meant for that nurse to only remind doctor with one sterilium, stand with the sterilium bottle. After he's moving to another patient, stop him and give him sterilium and rub his hand good. So we done this type of, some researches. Even nurses, I said, then we made a badge here for every nurse. Like, ask me, did you wash your hands? There is one logo. So when I'm coming to you, you will say that, Jagan, did you wash your hands? That means you can read me. So what happened? This type of small techniques and we done, but it is, you can say the miracles, you can see the, security. It is a continuous quality improvement meeting. So even the entrance of the OT, any surgeon, any anesthetist, any nurse want to enter inside the OT, there is called a scrub area. So there is a foot handle, you can see the wash, then we kept a CC surveillance camera there. If anybody entering inside the, see, this is all how to control it. Okay. Control infection, because you are maybe superstar doctor, but you cannot enter without washing your hands. You may be 20 years nurse, doesn't mean that privilege you have to enter without washing hands in the OT. So we kept a surveillance, we can able to monitor who is going what. So because that eagle eye, they make them to scared. Some people see, some people they do religiously, some people they do because of somebody is watching. But end of the day, we need to prevent or spread infection, one person to another person in the hospital. So medication errors, when we talks about, there is no, in Indian statistics. Okay, you take normally 10 prescriptions, 6 prescriptions having medication errors. That is what is the statistics of Indian now. So it is comes slowly, because of guidelines when keep, but it is not only the employee. The organizations should be strict to that guidelines and religiously they should implement. So it is, it's good for patient. That doesn't mean the patient can stay here more longer days, so hospital get a benefit. So this type of mentality should be, literally to be, tuned. Then this is a, yeah, medication there is a use. You see, we all are think that we are great. Anything fever comes now, you take some dolo, but you don't know what manufacturing date. Did you see manufacturing? They give cut pieces of this tablet. Did you see anytime they give one tablet? Did you know that they will mention that one tablet? What is the expiry date? No. People just see, like more than vegetable markets, you can see the pharmacies in India. Every street there are pharmacies. There are controlled drugs, even the controlled drug they give, just you ask, they will give. Right? So what I meant to say, when we see guidelines they're written, but how we implement, how religiously follow, that is impact on, so that's what. So out of 5 patients, every day there is one medication errors, I can say, as with my experience. But but you report it. Incidents should be reported. We used to have the policy. Our chairman says that how many incidents you raise, that much great. There is some rewards. Incidents means anything goes wrong, you should fill a form. See, when you write an incident, this is what the common psychology in the hospital healthcare till date. Incident means the things that I've done something wrong, so I'm writing, so somebody will punish you. No. Whenever you write an incident, it's good to see next on that incident, they do the root cause analysis and they go for the corrective and preventive actions. It is not to punishing someone else.
Right.
See, intentionally, you will not do the intentionally, but by mistake it will happen. We all are human. So these statistics give you to discuss on the continuous quality improvement meetings in the hospital. Then we can take precautions. Where we can do, it is all process change. It is not individual to punish something else. So that's what happened. The lots, use sector in the hospital is 300, 400 nurses, even the small hospital. They scared about because your culture you made like that. You change your culture. You motivate them to write. You recognize them. You win their satisfaction. Then in hospital, 80% you can see that no issues because those people who create issues or it may be success in the hospital. What I feel.
True. Thank you so much, Jagan, for coming to our show and sharing your valuable time and insights for a patient safety series at Medicircle. Thank
Thank
you.
you, Sana. Thank you so much. Nice to talk to you. It is a small topic. It is a huge topic, but within short duration, maximum what I can, this is. Thank you so much. Nice to talk to you,
Thank you. It
Sana.
was pleasure. Thank you.
Bye.
Bye.
Bye. Have a great day. Bye.
Have a good day.